So essentially, a forensic nurse is a nurse that's specially trained in managing the care of a victim of violence.
Okay.
So the easier and more kind of way to think about it is we're really at the intersection of healthcare and law enforcement. We're obviously never a part of law enforcement, that's not our job, but we have to take care of the patient's healthcare needs, always with an eye kind of on the courtroom, because they also have really kind of crucial legal needs at the same time. So really working with our community partners to kind of help close the gap in all these little needs, because really what happens when you're a victim of violence is you're given a piece of paper and people say, okay, well now go figure out how to make yourself better. And we have to do better than that. So that's kind of what we're working on with it within Harris County, and part of what I'm kind of a part of is trying to figure out how to get patients really all the things they need to become them again, become whole again.
Sure. Episode 105 on Think About It features Dr. Khara Breeden. She is the HBU Assistant Professor of Nursing. As a past program manager of the Harris Health Forensic Nursing Department, Dr. Khara Breeden is passionate about serving abuse victims. She founded and runs the Harris County Forensic Nurse Examiners, which bridges the gap between victims, law enforcement agencies, and treatment organizations. And I can't think of a more noble thing in life to do.
Yes.
I'm really serious about that. You know, I just struggle to comprehend how someone could hit a woman, hurt a woman, let alone a child.
Yeah.
I don't even get it.
And the magnitude of the problem is so much bigger than people realize. So,
how big of a problem is this?
They say 1 in 3 people are victims of sexual assault across the lifespan.
1 in 3 people are victims of sexual assault? Are you serious?
Yes, yes. I don't have the stat for domestic violence right off the top of my head, but it's astounding, really. And the services from a medical standpoint are so lacking, just because a lot of the focus has been on hospitals providing care for these victims. But if you really think about a victim of trauma, the last place that really seems like the right environment for them to be in is a chaotic emergency room, right? And so that's kind of been the standard, and that's really the national standard, is that emergency rooms across the country kind of have these specially trained nurses that will take care of victims of violence in the emergency room. But it doesn't really meet the needs that are actually there. A lot of them just focus on sexual assault, so victims of domestic violence or strangulation, human trafficking, child or elder abuse. A lot of programs won't even address those needs. So that's what we're trying to do with Harris County Forensic Nurse Examiners, is really just work with our community partners and create kind of avenues for these patients to be seen in other places besides an emergency room. So that's what we're working on.
Wow. So, I mean, you founded and run the Harris County Forensic Nurse Examiners.
Yes.
You're an assistant professor of nursing.
Yes.
At the HBU nursing program. I mean, you got a lot going on.
I do. And my daughter just graduated from the HBU nursing program and just passed her boards this past week. So it's been very exciting. Yeah.
Oh.
Yeah.
Well, that's awesome. And so does she know where she's going to go from this point?
She has a job at Southwest Memorial.
Okay.
She's going to work in the CVIMU.
Now, what does that mean?
It's like an intermediate care. So it's a place that a patient goes between like a med-surg floor and between the ICU. So it's kind of right in the middle.
All right.
So she's excited about that. So it's been fun to kind of walk alongside her in her journey in education here at HBU and have her in my classroom, and kind of like all of those things were really special. But now to see her kind of grow her wings as a nurse is really neat too.
Yeah, there's nothing better than to be able to teach and look out and kind of wink at your kid. And then you can also say, I'll get you, buddy. Or
Yeah.
You've seen a lot, I'm sure. I can only imagine what you've seen.
Yes, it really changes your perspective on where people are in their moment. Like, you just don't know what people have gone through that gets them to where they are. And I think there's a standard that people think that everybody's experiences are the same, but they're not all created equal. So I think that is pretty eye-opening.
How did you come to HBU as assistant professor of nursing? When was that and how was that?
So in 2016, I finished my doctorate, and I knew I wanted to teach. I had been teaching here as an adjunct faculty for probably 2 years before that with Dr. Schumann. And
she's terrific.
I honestly met her at CrossFit. Like we went to the same CrossFit gym, and you know, if you CrossFit together, you're like family. So that's how
if you survive.
Yes, right. So that's how I met her. And anyway, she actually was just finishing school. She reached out to me randomly and said that she was looking for a faculty to teach OB nursing, and I had a background in it. And I just really took it as a message from God that I was supposed to listen to. I was kind of looking for my new path at the time. And so I just decided that's what I was going to do. And it's been a great experience. I'm thankful for it in lots of ways. And knowing that I had this passion for taking care of victims of violence, it's been really kind of a nice way for me to integrate something different and kind of grow into maybe a bigger solution for these victims while also being here.
Well, indeed, and so. I mean, I can only imagine a young, formidable nursing student who's probably a very good person, doesn't know how evil the world really is out there, maybe. They've got to be prepared.
You have to teach them in stages, otherwise.
Oh, I can imagine.
Yes, you definitely have to teach them in stages, but I think that's one thing, like even in, like I teach, so now I currently teach maternal health, so OB nursing, and then I also teach pediatrics. And so it's kind of nice to integrate some of those topics as I teach, just so they don't get it all at once. They're kind of getting it in layers throughout my course in regards to maybe what they're going to come across as they take care of somebody who's either recently been a victim of violence or maybe in their past they've been a victim of violence. So it's a nice way to integrate it. Like today, half of my lecture was on sexual assault, domestic violence, human trafficking, because in maternal nursing, that's one of the topics that I get to teach anyway. So it's kind of a perfect fit. But I have several nurses that when they graduate, they say that they want to be a forensic nurse. So I feel like, maybe I'm doing my due diligence of creating other helpers to.
And what technically does a forensic nurse mean? I think I know the word forensic, but tell me, is it a nurse that documents that there is victimization, or what does that mean? So
essentially, a forensic nurse is a nurse that's specially trained in managing the care of a victim of violence.
Okay.
So the easier and more kind of way to think about it is we're really at the intersection of healthcare and law enforcement. We're obviously never a part of law enforcement. That's not our job. But we have to take care of the patient healthcare needs, always with an eye kind of on the courtroom, because they also have really kind of crucial legal needs at the same time. So it's just kind of being in the space of trying to connect victims in with maybe community partners that could provide advocacy and maybe counseling. The DA's office is our partner, but with a victim of domestic violence that's been in an abusive relationship, we can connect them in with the DA's office to help get protective orders. So really working with our community partners to kind of help close the gap in all these little needs, because really what happens when you're a victim of violence is you're given a piece of paper and people say, okay, well now go figure out how to make yourself better. And we have to do better than that. So that's kind of what we're working on within Harris County, and part of what I'm kind of a part of is trying to figure out how to get patients really all the things they need to become them again, become whole again.
Sure. In many instances, it is not danger stranger that's perpetrating the offense. Against your children or against a spouse, it's often someone they know, someone close.
Yeah, most often it is.
And, a lot of people don't know that, do they?
No, I don't think people realize that. I think, the movies portray the guy, bad man with a mask or a van that has the darked out windows, and that's always the bad guy. And so I think that's kind of what TV and movies and all that kind of have us believing. It's kind of nicer to believe that. So I think there is a part of that that's protective, right? If we all kind of just assume that everybody in our family might do something bad to our children, then it'd be a hard world to live in. So I think some of it's protective and some of that's okay. I just think that we all have to kind of have it in the back of our minds that things happen, and you have to have your eyes open enough to know that, it can happen.
Give us some examples, and I mean, I know you don't want to be too graphic, but I mean, what all have you run into at Harris County Forensic Nurse Examiners? I mean, what does it all entail?
So HCF&E, or Harris County Forensic Nurse Examiners, we actually are just getting ready to launch. So we'll launch on February 18th. So we're a new nonprofit organization. But in regards to my experience as a forensic nurse, the experiences are kind of wide. I mean, I've taken care of patients that have just, maybe they've been shot, and they've been brought to the emergency room, or, children and adults that have been victims of, either physical or sexual violence. So just a wide range of patients and things that happen to people.
And so the nurse has to be sophisticated and trained adequately to identify if there is some victimization, and then I guess there's an appropriate protocol that you follow.
Yeah, and a lot of it is understanding victimization, because just for example, a victim of human trafficking often doesn't realize they're a victim. And so if you don't approach them as a patient or as somebody that has a specific other need, and you treat them like a victim, oftentimes you're going to lose them, because a lot of times they're in a kind of a dysfunctional relationship to where they actually probably distrust us as the healthcare provider more so than the person that's actually trafficking them. So a lot of the dynamics in relationships are really kind of not the way most people would see them, and you have to understand that to be able to really manage that patient. Otherwise, you're going to go about the wrong way and lose them.
Dr. Breeden, I've got to ask you how you got a heart for this particular area.
I really just feel like it's what I'm supposed to do. I feel like this is my purpose. I kind of, when I came here in 2016 and walked away from Harris Health, I really had to, I kind of let it go for a little bit, and then I just knew that it was part of who I was. When I became a forensic nurse, it was totally by accident. It wasn't ever something that I want to do this when I grow up kind of thing. But once I was there, I knew it's exactly where God intended me to be. And so then when I got here and, integrating faith into the classroom and really growing stronger in my faith, I knew that that was something that I was called to do and that I had to continue. And so honestly, in the summer of, I guess, 2017, the chief of family violence at the district attorney's office, her name's Khara Breeden, she really changed the trajectory for me, because I've had this idea of trying to develop this community-based program and really connect victims the way I've talked about. And her and I met, and she basically was like, well, that's what you need to do. You have to do this. Like, this is what patients need. And she really kind of has been my encourager and really my support as I kind of got started. And then as I got started, everything's just kind of, fallen into place. But as I was kind of creating this program, obviously when you start any business, you hit lots of roadblocks and no's and all the things, right? And over the summer, I had several meetings that didn't go the way I wanted them to, and I was just like, do I quit? God, please help direct me. Like, I need to know what I'm supposed to do here. And it was just like, as soon as I turned it over, it was one thing after the other opened up for me. Or not me, but the organization. And it's been like that ever since. And so I just have decided it's not really something I'm doing. I'm just a catalyst of letting this work happen. And I'm just kind of along the ride and help kind of move things around where they need to be and pull the right people into the path to make it work. So that's really all it is.
You have to have a tremendous faith in Christ to be able to see such abuse and to see such darkness and be able to be challenged by it.
Yeah.
To be anecdotal to it.
Yeah. When I first started, it was hard. I just couldn't understand, how could God let this happen to people?
Right.
Like I went through that phase. And, just going to church and kind of working through it and working through this with other people, other, followers, I kind of was able to digest it in a way that made more sense to me and, change my frame of thinking towards it. So where I'm giving back and this is what my purpose is. And so once I did that, it's been easier for me to kind of manage.
In my career, I've seen a lot of really horrible things that people can do. I've been in every kind of penal, mental institution, not just in this nation, but others. And, there's been nights where you go back to the hotel or you go back to your room and you just think, oh my goodness, Lord, how could it be, And God obviously works in spite of man who's a free moral agent. I can run across the highway and God will let me, but I might get hit by a car. He gives us a free will. Enter Renee Schumann in CrossFit and you coming to HBU.
Okay.
Tell us that.
Which part?
Well, you met her and somehow that was corollary to you coming here?
Yeah, we worked out together for several years, and when I finished my master's, I kind of contacted her and was like, hey, I kind of wanted to do like teaching, like, can I do that? She was, so she brought me on board and I did adjunct clinicals for her for at least 2 years. And then, but it's just been amazing working for her and the entire nursing team. We have a real tight-knit family over there. So, but it's been great. It's been, the students here are unlike any other. And it's really just a blessing to be a part of their educational journey and to watch them grow and, kind of be alongside them for that. I treat them all like they're my kids. And so, it's just fun to watch them kind of start to finish, grow their wings.
HBU nursing students are highly sought after by the hospitals here in Houston.
Oh, yeah.
Why is that?
We do something different for them, and I can't take any credit for it. I really think it is the biblical background and bringing Christ into the classroom. I really think that's a huge piece of it because it's just the expectation. I think we talk about professionalism from day one. I think we talk about being a team player and being a employee or staff or coworker that you want to work with, showing up on time, being that person, not talking, ugly behind somebody's back. Like all of those things, we kind of teach that from day one so that, yes, we can teach you pediatrics and all of the things and how to, put an NG tube in, but really we have to teach you how to be a good nurse, and how to be a kind human and how to really care about your patients. And I think we do that well.
We live in this Me Too moment, and there's many aspects of the Me Too moment that I think have been very good. I mean, I have a different take than some people. I think that females have been abused very often in the work environment, and it's intolerable.
Yeah. And it might not be in some people's space, so I think sometimes it's hard for people to see. But I think if you, again, look past maybe what your normal is and kind of really try to understand what other people go through, especially in lower paying jobs and factories, places like that, I really think that it can be a real big issue. And then obviously even with high paying jobs with actors and actresses, I think it was really something that's really shed a lot of light. I think there's always good with the bad, but I think it's definitely been more good than bad. Yeah. Just the awareness alone.
We do have parents and prospective students that are thinking about trying to get into nursing. Why would you tell them to consider HBU as opposed to another nursing program if they can get in?
Well, mostly because we are a smaller group. So it's not a huge group. I know all my students, like the first 2 or 3 weeks of class, it's always a game for me to learn all their names. And so I take great pride that you are somebody I respect in my classroom and I care about you. And I think that's just that care alone is something that you're not going to always get everywhere else. And just again, we're there. Right before I came over here, I have had 3 students in and out of my classroom just to talk about whatever today, and we're there for them. And they they email us, they contact us. I think they trust that relationship. So I think that alone, gives them the support through the program while they're learning, while they're growing. They have somebody that believes in them at the same time.
So you've got really a dual role now. You're assistant professor of nursing, and then also you're running the Harris County Forensic Nurse Examiners.
Yes.
And that's a 501c3.
Yes, it is.
And it's here in Houston.
Yes, it is.
Very good.
Yes, it is.
Wow. And my deepest respect to you, and what a gift you are to HBU. You can learn so much more about HBU nursing program at hbu.edu/nursing. Meet Dr. Khara Breeden and the entire team. Of course, Dr. Renee Schumann. And we just want to thank you so much. Keep on doing what you're doing. Is it true that the abused abuse?
Not always. They need the care. They need to get, if you can get somebody that's been abused, you can get them in, therapy, and you can get them the services they need, then absolutely not. We have to believe people. It starts by, believing that things happen and getting people connected with ways to make them better, so that doesn't have to be it does not have to be a cycle of abuse.
That's a good word to end on. Khara, thank you so much for being with us.
You're welcome. I appreciate it.
Keep doing what you're doing.
Thanks.